The following educational video was created in collaboration with the Faculty of Biomedical Engineering and the General University Hospital. Short peripheral catheters are classified as short-term venous access devices. The catheter is inserted into the venous system with the distal end placed outside the cava-atrial junction. This allows the administration of medications that do not irritate the venous endothelium with a pH of up to 9 and an osmotic concentration of 600 milliosmoles. For parenteral nutrition, the osmotic concentration can be up to 900 milliosmoles. Insertion is indicated not only in emergency situations but also for diagnostic, therapeutic, and nutritional purposes. The planned interventions for insertion should not exceed 1 week. When choosing the insertion site on the upper limb, veins on the dorsum of the hand and forearm with a larger lumen and straight course should be preferred, as they are easily palpable and well filled. We start with the non-dominant limb, beginning with veins located lower down and alternating hands. The optimal insertion zone for a peripheral catheter is the forearm. The median cubital vein should be preserved for blood draws. There are recommendations to remove hair from the insertion site before insertion. Ideally, the hair should not be shaved but trimmed with a clipper. So the patients are individuals from all age groups who are expected to have difficult venous access. To assess the risk, we can use a risk scale and its modifications. This group includes, for example, individuals with a depleted venous system, drug users, obese patients, seniors, cancer patients, people with tattoos, and others. Patients are also at risk if venous access is limited to only one side. The insertion of the catheter is contraindicated in veins on a limb with an AV fistula. Insertion should also be avoided in the paralyzed limb or on the side where a breast ablation has been performed. To ensure venous access for such high-risk patients, the most experienced healthcare professional should be consulted, and if possible, insertion should be done under ultrasound guidance, or alternative vascular access should be considered. The size of the catheter is chosen based on the type, amount, and speed of the solution to be administered, taking into account the peripheral venous conditions. The catheter should not occupy more than 1/3 of the vein and should never completely occlude the inner lumen of the vein. A smaller catheter causes less trauma for the patient, reduces the risk of mechanical irritation of the vein, and allows for greater blood flow, which leads to faster dilution of the administered medication. A larger catheter allows for quicker administration of the solution. Before inserting a short intravenous catheter, hand hygiene and disinfection should be performed, and patient identification should be verified by checking the identification label, including confirming the patient's name.